Endocrine system drugs. The endocrine system. Endocrine refers to the internal secretion of hormone produced by the ductless glands that secrete directly into the bloodstream. Hormones are chemical messengers that have specialized functions in regulating the activities of cells or organs. Diabetes and thyroid disorders are the most common disorders in the endocrine system. Thyroid disorders. The thyroid is responsible for regulating the rate of metabolism. When thyroid levels are low and the pituitary gland releases TSH. TSH promotes the secretion of the thyroid hormones T4 and T3. Iodine is vital for the synthesis of these hormones and is provided through dietary intake, such as table salt. There are thyroid medications, and then there are also anti-thyroid medications, which we will talk a little bit more about in the following slides. Thyroid lab work. So a normal TSH means thyroid stimulating hormone, levels are normal when they are 0.5 to 4.0 milliliters per unit of liters. Hyperthyroidism shows on lab work as a decreased TSH, so a low TSH level, but the T3 and T4 levels are increased. Hypothyroidism is an increase in TSH levels and then shows a decrease in the T3 and T4 hormone levels. So when TSH is not being secreted highly, such as in hyperthyroidism, that means that there's already adequate T3 and T4 in the bloodstream. Versus hypothyroidism, there isn't adequate amounts of T3 and T4 in the bloodstream, so TSH is produced at higher amounts to help stimulate your system to increase the production of the T3 and T4. Thyroid agents. Replacement therapy in hyperthyroid patients, so we replace the thyroid hormone. The drug that is most commonly used is levothyroxine, also called Synthroid. Synthroid is the brand name, which is synthetic T3 hormone. This drug increases the T3, which results in a decreased TSH level. So the TSH level will be elevated in these patients. And once we give the levothyroxine, that will stimulate the T3 production, which will then in turn decrease the TSH level. Patient instructions. It is important that patients do not skip doses. They take at the same time every day. They take on an empty stomach for 30 to 60 minutes prior to eating to help the absorption of these hormones so they are not destroyed by food or drinks that they may encounter in the stomach. And then do not change the brands of medications. So different brands might have different levels of hormones, even though they are all the same dosage. Different manufacturers have just a little bit different synthetic formula for the T3. Why are thyroid agents not used for weight reduction programs? We always think about the thyroid as it increases our metabolism, or if we have low thyroid function, it decreases our metabolism. And the reason why we don't use it for weight reduction and increasing our metabolism is it can lead to a decrease in the normal thyroid function, and then it can also be possibly life-threatening with cardiac arrhythmias as one of the major side effects. So if we don't need to take these medications, it is better that we don't cause harm that's not necessary. This picture is a picture of levothyroxine or Synthroid. The first day when a patient first starts taking it, they still are going to have those symptoms of bradycardia, lethargy, constipation, excessive fatigue, excessive sleepiness. The fourth day, they are a little bit better, and then the sixth day, they are feeling back to normal. They are feeling good. However, if a patient chooses to miss a dose, the first day they're feeling all right, but by the fourth day of missing a dose, they're feeling kind of crummy, and then by the sixth day, they are feeling lousy. They are feeling that bradycardia, lethargy, constipation, excessive fatigue, excessive sleepiness. We also need to watch for doses that are too high or hyperthyroidism, which can cause irritability, palpitations, tachycardia, diarrhea, tremors, and insomnia. Antithyroid agents. Treatment for hyperthyroidism. Decreased TSH and increased T3 and T4. Symptoms: tachycardia, nervousness, a goiter or enlarged thyroid gland. Drugs are not usually for long-term treatment. Drugs usually are used in between the gaps of getting either radioactive iodine treatment or surgery, which are more of our long-term treatments for this condition. Methimazole or tapazole is the common, most effective drug used for hyperthyroidism. It blocks thyroid storms. Thyroid storms are a thyroid toxic crisis, is acute and life-threatening, usually causes a hypermetabolic state from the excessive release of thyroid hormones. You'll see fever or an increased body temperature, increase in blood pressure, severe hypertension, tachycardia, heart failure, and shock further down the road. So this drug helps prevent that until we can give some iodine or radioactive iodine treatments. Diabetes mellitus. Insulin is a hormone produced by the pancreas. It acts to maintain blood glucose levels within normal limits. Insulin is essential for moving glucose into the cell for metabolism. As you see here, we have a little insulin that connects with the receptor, and then it allows the glucose to come through its pathways into the cell. So without insulin, this glucose cannot be permeable to the cell membrane. So we need that insulin with the glucose. Diabetes mellitus is a chronic disorder due to insufficient production of insulin by the pancreas or cellular insulin resistance. So sometimes those insulin cells are not connecting with their receptors, which causes cellular insulin resistance. Pancreatic hormones. So high blood glucose, the pancreas releases insulin, which thereby the liver produces glycogen and the cells take up the glucose from the blood, which causes the blood glucose to fall. Low blood glucose, pancreas releases glucagon, which then the liver breaks down the glycogen, which the blood glucose then rises. So how does insulin therapy work? Insulin increases peripheral glucose uptake by the skeletal muscles and fat tissues by inhibiting the liver from changing glycogen to glucose. So insulin, there are specific insulin syringes that are typically used. Most are U100 or 100 unit syringes, which means there are 100 units per milliliter. A 100 unit syringe, each line represents 2 units. So on here, if you can see 20, 22, 24, 26, 28, 30. So each unit is each line is 2 units. A 50 unit syringe, each line represents 1 unit. Most of the syringes out there that you will see are 100-unit syringes. Insulin types, onset, and peaks. A little cartoon shows you that the Lispro is a fast-acting, acts rapidly within 15 to 30 minutes, and peaks within a half an hour to 2.5 hours. Your regular starts fairly fast in a peak of 1 to 5 hours, starts around 30 to 60 minutes. NPH is our intermediate, starts more slowly, peak around 6 to 14 hours, with a start of about 60 to 120 minutes. And then our Lantus is our long-acting. There is no specific peak, and usually starts acting around 70 minutes. It's important to know the onsets and the peaks and the durations of the insulins for safe, effective treatment. We don't want to put anybody into hypoglycemia due to incorrect dosages. So here's the insulin chart. There's also a chart in your book. You will want to memorize this for your unit tests and also for your final exam. So rapid acting insulins, there's Humalog, Novolog, Lispro. Onset is 10 to 30 minutes, peak is 1 to 2 hours, duration is 3 to 8 hours. Rapid acting insulin covers insulin needs for meals eaten at the same time as the injection. This type of insulin is often used with longer acting insulins, so often used with Lantus. Short acting names are regular, Humulin R, Novolin R. Onset is 30 to 60 minutes. Peak is 1 to 5 hours. Duration is 6 to 10 hours. Short-acting insulin covers insulin needs for meals eaten within 30 to 60 minutes. So this one can be given after meals. Rapid is typically given right before meals. Intermediate, also called NPH, Humulin N, Novolin N. Onset is 1 to 3 hours, peak is 6 to 12 hours, and then duration is 18 to 24 hours. Intermediate acting insulin covers insulin needs for about half of the day or overnight. This type of insulin is often combined with rapid or short-acting insulin. Long-acting insulin, Lantus and Levemir, very popular. Onset is 1 to 2 hours. There's no peak for this medication, and the duration is up to 24 hours. Long-acting insulin covers insulin needs for about 1 full day. This type of insulin is often combined when needed with rapid or short-acting insulins. Mixtures. Mixtures consist of a variety. The most common is NPH with regular. The onset is 30 to 60 minutes, peak is 1 to 4 hours, and then duration is 16 to 24 hours. There's also NPH with Lispro and NPH with Aspart. These products are generally taken 2 to 3 times a day before mealtime. Combination products. Combinations can increase the onset of effects while maintaining long duration of glycemic control. An example, insulin 70-30, very popular, 70% NPH and then 30% regular. Oftentimes patients will be put on a sliding scale for insulins with their short and rapid acting insulin dosage. So patients will be, when they do their finger poke or their blood glucose testing with their kid at home, they will do that and then get their numbers, and then they will be given a range. And whatever their number is, then they will go to that range. So say a patient's blood glucose was 213. So then we would give, most patients are in the normal insulin sensitivity, so then the patient would give 4 units for a blood glucose of 213. If you had a patient that had a blood glucose of 340, then we would go with 8 units. That patient would then give himself 8 units. So a lot of patients are on sliding scales depending on what their blood glucoses are. This typically happens with patients who are new to insulins or insulin therapy, just because they have a hard time regulating and getting down their food choices, and then how their body reacts to the insulin that they're given. So by giving them a sliding scale, they have a little bit more flexibility. Oral diabetic medications. There's 6 types. Sulfonylureas, alpha-glucosidase inhibitors, butyratides, incretin therapies, meglitidines, and zolpidiones, which is a tongue twister to say. Sulfonylureas act in 3 ways. They stimulate the release of insulin from the pancreas. They inhibit the process of forming glucose from amino acids and fatty acids in the liver. They increase the number of insulin receptors to target cells. First generation medications are not commonly used today. Some examples, the most common one, which I have not seen prescribed in a really long time, is tolbuminide. More commonly prescribed medications are the 2nd generation, glimepiride or Amaryl, glipizide or glucotrol, or glyburide or Dibeta are the more common ones prescribed today. Some of the side effects are GI distress, weakness, fatigue, lethargy, headache, hypoglycemia, especially in older adults. Alpha-glucosidase inhibitors lower blood sugar by delaying the digestion of carbs or sugars and absorption of carbs or sugars in the intestines. Drugs are arbicose or precose. Some side effects are GI issues and elevated liver enzymes. And this one can impair the liver and kidney function, so it's important that patients have a normal liver or kidney function prior to starting this lab, and then usually need checkup after starting this medication. Butyratides act by reducing hepatic glucose production and increasing insulin sensitivity in muscle and fat cells. The most common is metformin or glucophage. Is considered the first-line treatment for diabetics. Is very effective in treatment in diabetics. This medication is given usually to type 2 non-insulin dependent diabetics first. Some of the side effects that come with this medication are GI effects and hypoglycemia. This medication should be watched because it can cause liver and kidney function impairment. Also, there is an interaction with this medication and the dye that is used for radiology exams. So any type of CT scan that has the dye injected, or a heart catheterization that highlights the heart, this medication interacts with those dyes. So this medication does need to be stopped 2 days prior to those tests, and then the patient needs to remain off 2 days after the testing. Part of it is this medication makes the kidneys work harder, and so does the dye, and can put patients in renal failure if the patient is on both at the same time. Incretin therapies, there's 2 categories: dipeptidyl peptidase 4 inhibitors. Increase in incretin hormone will increase the insulin secretion, and a decrease in the glucagon secretion. The drug is Januvia. You see the advertisements quite frequently on TV. Glucagon-like peptide 1 receptor agonist is the other type. Increases insulin production and secretion from the pancreas in response to increased glucose levels. The medication under this category is Byetta. Meglitides act to lower blood glucose levels by stimulating the release of insulin from the pancreas. Drugs are Starlix and Prandin. Side effects, GI side effects, initial weight gain, and upper respiratory infections are common with this medication. These medications are not as widely prescribed, mainly because of the higher incidence of respiratory infection. Thiazolinidiones decrease insulin resistance and increase insulin sensitivity by modifying several processes, with the end result being a decrease of hepatic glucogenesis, an increase in insulin-dependent muscle glucose uptake. Common medications are pioglitazone or rosuglitazone, also known as Actos and Avandia. So what is important to tell your patients? I can tell you that you will also need to know some of these patient education points for your exam, for either your LP9 exam or your final exam. Hypoglycemia prevention and symptoms. So what are the symptoms of hypoglycemia? Balanced diet, so a low carb, low sugar diet, reporting nausea, vomiting, and infections, taking medications at the same time of day, each day, proper use of monitoring devices, so using a Sharps container, and using different needles for each finger poke that you do. Some patients will try and save supplies because supplies and medications are very expensive. Rotate injection sites, so you can use the abdomen, the lower back, the thigh, the back side of your arms. Your limb sites have a faster absorption rate and act a little bit faster, so if you are in a hyperglycemic crisis and need to get some insulin on board, those would be your preferred sites versus the abdomen or the back. Check insulin expiration dates. Regular insulin should be colorless. Roll insulin vials, don't shake them, so roll them in between the palms of both of your hands. Short-acting insulin should be drawn up first. Storage should be 2 to 8 degrees Celsius, so in the refrigerator. Insulin should avoid direct sunlight.